Assalamualaikum and good evening. I bid to Doctor and my fellow classmates. So today I'm Adam and Ng Eun, a representative from our group to present the human organ culture, updating the approach to bridge the gap from in vitro to in vivo in inflammation, cancer, and stem cell biology. As you can see here, this is our group members. So this is our presentation outline in which we will cover the introduction, methodology, application of HOCs, and also the comparison of HOCs. So throughout the presentation, we will using HOC to refer the human agriculture. It is actually their acronym. So the learning outcome of our presentation in which we will understand and analyze the methodology of HOC, we can identify the difference between HOC, organ in the chip, 3D culture, and 3D bioprinting. And obviously, we can understand the application of HOC. So for the introduction, why were HOC more preferable? This is because preclinical animal studies have had limited success in predicting human physiology, pathology, and also the therapeutic responses. Human organ culture actually offer a simple approach that may better address this issue. For example, we can see from the past 30 years in which they include insights into the inflammatory process and diseases, cancer, and also in stem cell biology. So how they approach in optimizing the HOC? There are several methods, and we listed 4 of them. So there are immunochemistry, immunofluorescence, Western blot, and also epidermal growth factor. Besides, technology developments enabling and imaging have also been to an extent that investigation are able to have responses in geographic and also in temporally in a molecular level of a therapy inside a tissue. So now we move to the application of HOCs in which HOCs preserve cellular responses that may be lost in cell culture. So we can see the cellular responses in the kidney organ culture, in the saphenous vein, and also in tonsil culture. So the cellular responses can be seen, can be observed in the kidney organ by the expression of fibrotic markers, and also in the vein, which is the expression of chemical receptor, and also the tonsil culture, in which the upregulation of vascular adhesion protein. There also one more cellular responses, which is the skin organ culture, in which we can observe the expression of his major histocompatibility antigen, short for which is their short is HMC. So next application is HOCs can reveal positional effects upon cellular responses. So what does it mean by positional effects? Positional effects meaning that the action or mechanism that included that involve the position of a particular site. For example, in the endothelial cells, which is it responses to stimuli in vivo that is actually very sensitive to the anatomic position. And there are also the superficial vascular plexus and also in HOCs itself. So HOCs can also be used to study stem cells, in which we can study in the heart disease and also for the comparison between the normal and also the tumor stem cells. So next is the HOC can reveal altered responses and also signaling pathways in disease, in which we can see in 4 mechanisms, in which in the inflammatory diseases, organ transplantation, systemic disease, and also in cancer. So inflammatory disease, so one of the mechanisms that can be used as an example is psoriasis vulgaris, which is it shows the hyperproliferation of epidermal cases. So the disease that involved is the psoriatic lesions and also involved at the sites that is uninvolved by lesions and also in the perilesion skin. For the systemic disease, it is actually involve the magnetic resonance imaging the gadolinium-based contrast agent, which is short for GBCAs. So GBCAs in skin organ culture can also be in the case culture and it can also in the fibroblasts. So these are the disease that are represented by in the systemic disease. So for the organ transplantation, So we can see in the expression pattern of TNFRS, which is actually differentiate between the renal cells in situ from the cultured renal cells. Because in renal cell in situ, both receptors are actually typically expressed in the same cell. So in cancer, we can see that the mechanism and expression of the particular site actually resulting in the majority of cells dying via necroptosis. So now for the study therapeutics, I will pass to Nguyen. Thank you.
Okay, thank you, Adam. Now let us look at how the human organ culture used to study the therapeutic. For culturing the blood vessel enable us to determine the efficacy of how replication defective adenovirus spike, a vector which carry a beta-galactosidase to vascular epithelium culture. Second is the skin organ culture that is used to characterize the factor that determine the lentiviral factor tropism. Then, by culturing normal squamous cervical tissue, we can use to test the effect of potential anti-cancer drugs such as recombinant human thrill. And the next one is the human organ culture can also be used to treat various pharmacological inhibitors such as siRNA, the short interfering RNA, or antisense oligonucleotide. Yeah. So this will make the research to be more understand of the molecular function of the cell in situ. Not only that, human organ culture is also function as a de-endothelial spinal speed. Yeah. In this session, we would like to do the comparison among the human organ culture with 3D culture, 3D bioprinting, organoid, and also organ in a chip. Next slide, please. Now, let us look at the 3D culture. So, what is the advantages of the 3D culture? The advantage of the 3D culture is the cell can have prolonged incubation period as a tool for investigating cellular response and also great for drug discovery and withstand for more stress. While the disadvantages of the 3D culture is very expensive and lack of natural architecture. And the next one is the 3D bioprinting. So let us look at what is the advantages of the 3D bioprinting. Yeah, for 3D bioprinting, the advantage of 3D bioprinting is the material provide have high biological property and also which cause it to create biomimic tissue. Meanwhile, the disadvantages of 3D bioprinting is very expensive as the 3D culture that I explained just now. And also 3D bioprinting is technically difficult. Yeah, and the process may cause cell damage. Moreover, for 3D bioprinting, the material can suffer base-to-base variation, which is very vulnerable for the scientists to obtain the accurate result. Yeah. The next one is organoid. So now let us look into detail. What is the advantages and disadvantages bring by the organoid? For the advantages of the organoid, they are retain the tissue identity, is as the in vitro in our body, and also generate tissue from pluripotent cells and withstand long-term culture. Adversely, its advantages are careful formulation of media are needed in order to ensure the cell to grow healthy, and also the cell growth can be limited by the diffusion of oxygen. The last one is organ in a chip. While for the organ in a chip, the advantages of organ in a chip is because we know that organ in a chip is a multi-fluidic chamber that provide interconnection between the tissue and also organ. So it will somehow have the interconnection between the tissue and organ, so it make more the connection will bring more like significant impact for the scientists to know more what is exactly the relationship between the tissue and also the organ, what is the connection among them, and also it allows the scientists to access and discover new drug. While the disadvantages of organ in a chip is fail to mimic the in vivo architecture and lack of crosstalk from the multiple cell types. All in all, my study of human organ culture is allow a researcher to discover more a new diagnostic and also medical treatment in the cancer therapy. Yeah, that's all from group 1. Thank you for your listening.